Hi all. Today being 29th day of svasthya365 day project, as a continuation, let us discuss about types and diagnosis of the lung cancer. Types of the lung cancer. Lung cancer can be classified into two types: small cell lung cancer and non-small cell lung cancer. This classification depends upon the microscopic appearance of tumor cells. And these two types of cells are spread in the different ways and may have different treatment. Hence, before starting the treatment, and type of a cancer should be confirmed. 20% of lung cancer or small cell type of lung cancer, which is the most aggressive and rapidly growing of all lung cancers. Small cell lung cancer is related to cigarette smoking, with only 1% of tumor occurring in the non-smokers. Small cell lung cancer will spread rapidly to many sites within the body, and these cancers are sometimes called as oat cell carcinoma. Next, we move on to the non-small cell lung cancer. Non-small cell lung cancer are most common type of lung cancer, accounting for 80% of all lung cancer. It can be divided into several main types that are named based upon the types found in the tumor. So first subtype is adenocarcinoma. Adenocarcinoma are mostly common seen type in USA and comprise 50% of normal cell lung carcinoma. So most adenocarcinomas arise in the peripheral areas of lungs. So next we move on to the another subtype, squamous cell carcinoma. Squamous cell carcinoma are seen in 30% of non-small cell lung cancer and also known as epidermal carcinomas. Squamous cell cancer arise more frequently in central area of bronchi. Next we move on to the another subtype, large cell carcinoma. Large cell carcinoma sometimes referred to as undifferentiated type, which is the least common type. Next we move on to the another subtype, bronchial carcinoids. Bronchial carcinoids account for only 5% of lung cancer and also called as neuroendocrine tumors, most commonly in the people under 40 years of age. Cancers of supporting tissue such as smooth muscle, blood vessel, cell involved in the immunoresponse rarely occur in the lung. So next we move on to the diagnosis. If doctor identify a suspicious lesion on the person and screening, and a person is experiencing symptoms that could indicate the lung cancer, several diagnosis tests can be available to confirm. First diagnosis test is imaging studies. CT and PET, that is positron emission tomography, can be used to reveal the areas of lung tissues with cancer. Bone scans can also indicate cancerous cells, and these scans are also used to track the progress of treatment. Next method of diagnosing is tissue sampling. If doctor identify a suspicious lesion on the imaging study, they might recommend the taking of tissue sampling to test the potential cancerous cell. There are different ways to take a tissue sample, and methods often depends on the location of the lesion. One example is when a doctor performs a bronchoscopy, which involves inserting a special thin lighted scopy with the camera on its end. This helps to be the doctor to see the lesion and then to obtain samples. Less accessible lesion in the lung may require more invasive surgical procedure and to remove the lung tissue. Next we move on to the another process of diagnosis called lab testing. A doctor may also enter the sputum testing or blood testing to check the presence of cancerous cell. Sometimes a cancerous cell may be hidden or doesn't show in the imaging scans, but cancerous cell might appear in the sputum. The doctor will use the information to determine what type of lung cancer may be present and how advanced the disease has become. If lung cancer is diagnosed, other tests has been done to find how far the spread of lung cancer in the parts of the body. This process is called staging. The stages are: stage 0, abnormal cell present in the top layers of airway cells lining. Stage 1, tumor has developed in the lung but is under 5 centimeter and has not spread to the all parts of the body. Stage 2, tumor is small than 5 centimeter and might have spread in the lymph nodes and area of the lung, or smaller than the 7 centimeter, spread near to the nearby tissue but not lymph node. Stage 3, cancer has spread to the lymph nodes and reached the other parts of the lung and surrounding area. Stage 4, cancer has spread in the distinct body parts such as bones or brains. So thank you. Stay tuned for more details about treatment, prognosis and precaution.